Welcome, welcome, welcome on in. Hey Brittany, welcome on in. I just hopped on. I'm just sending it out. I'm waiting for my moderators to come on in. Hey Mandy, how are you? Brittany, did I get a follow-up or do you have a follow-up to give me from that last message you sent me, Brittany? How did everything work out? Was it legit? I don't want to talk about it on live in front of everybody, but just send me a message. What's going on, Aaron? Thank you for joining. Mandy, thank you so much. Thank you for grabbing your daily heart me. As we are hopping on in, we're liking the live, grabbing our daily heart me. Once we hit 5K likes, we're going to go ahead and get started on our trending topic in healthcare. And moderators, you can go ahead and share it out. Thank you so much for your support. Mandy, how are you doing? Aaron, how are you doing? I'm checking in with y'all before we get to the 5K and before I get busy. How are you doing, Mandy? And Aaron, how are you doing? Okay, you're having a good day? Awesome. I'm having a good day today, too. Okay, Aaron, you in DR? How is it in DR? How is the experience? How is the beach? How are the people? Because I've heard mixed reviews about Dominican Republic. Traveling there as a person of color. Even though the country is filled with people of color. Awesome? Okay, good. That's good to hear. Dr. Lewis, welcome on in. Thank you for joining. Let me add it to my story. How long are you there in DR, Aaron? Thumbs up in the chat if the audio is good. I lost my microphone, so until my new one comes, we're gonna wing it. How is the audio in the chat? Thumbs up in the chat if the audio is good. Hey, Dr. Lewis, I see you. Okay, perfect. Thank you. Okay, until Thursday, and then cruise on Friday. Okay, nice. Where are you cruising to? Is it a long cruise? Is it a week cruise or a 3-day cruise? Who is it? Norwegian or is it Royal Caribbean? Who do you normally cruise with? Thank you for the gifts, Mandy. Wait, did you go to the port? Because you're in North Florida. Is there a port? Is there a port up there in North Florida, Aaron? Yes, Dr. Lewis, he's in DR. Bahamas 7 days on Carnival. Okay. Okay, is this your first cruise or you've been on a cruise before? I've heard mixed reviews about Carnival too. You gotta let me know how your overall experience is. Mandy, thank you so much for that goal. 88, welcome on in. Welcome to Office Hours with Dr. Johnson. As we're coming on in, we are grabbing our daily heart, watching the live, and getting it to 5K likes. Once we hit 5K likes, we're gonna go ahead and get started on our trending topic in healthcare. Hey Brittany, how are you doing? I don't know if you, I was talking to you earlier on, Brittany. I don't know if you were here, but how did everything go? From that last message I'm screaming. Why am I screaming? My God. Brittany, from that last message you sent me, I don't want to say it in front of here everybody, but how did everything go? Was it legit? Send me a message for a follow-up. From that last message that you sent me, I would like a follow-up. Because I was really invested. This is my 10th Carnival cruise. Okay, so Aaron, at this point, I'm sure you get like what, a member's discount? Thank you so much for pinning that, Mandy. Right. Okay. So okay. Did you follow up with them, or I'm gonna have to? Please, yeah, that's what I want to know. Because the reason why I want to know is I think I'm going to do a topic on specifically what you're going through with that employer. I don't want to say too much on here because I like to keep my topics a surprise for the office hours. But that specific topic, I think I want to discuss it. So share with me the details when we hop off of here to add to my next topic discussion for next Tuesday. I only pay taxes and port fees. Okay, so you got a discount. Oh wait, let me scroll up in the chat. Did you say something else? That place was scamming. Okay. That'll be right, because guess what, Brittany? A lot of people are going through what you're. It's not just you. Or I like the song. It's literally not just you. It's a lot of people. So bringing awareness to that issue specifically is important. For those of you on here, yes, Jamaican music today. I was feeling it. Gerline, welcome on in. Today's office hours. We're gonna do a trending topic in healthcare. You guys know I breeze through my trending topic in healthcare, and then we have a special, just a little twist for today's interview that we're gonna do, and then we're gonna end it off with a professor tips relating. It's similar to what we did last week, relating back to school. So we have some great tools for back to school professor tips that I'm gonna leave you guys with. But once we hit 5K likes, we're gonna go ahead and get started on our trending topic in healthcare. Dr. Lewis, I almost put the compa music, but I was like, let me stick to my roots, right? Did I add it to my story yet? Almost there. Once we hit 3K likes, we are plus I'm Haitian in your world. Doctors, you don't know how many times I get that. Every time you see me, you tell me that. Yes. I did it. Okay, I added it to my story. You know what I realized, you guys? You see, when you bring somebody up, that share button, it kind of gets wonky and things change. Renata, welcome on in. Office hours with Dr. Johnson. You joined right on time. We're just waiting to get to 5K likes. Once we hit 5K likes, we're gonna go ahead and get started on our trending topic in healthcare. I like it. We are one big Caribbean family. Yes, one big Caribbean family, Dr. Lewis. What is this setting? Okay. Dr. Lewis, I didn't check in with you. How are you doing today? Checking in. How are you? Before we jump into the trending topic, how are you doing today? What did you accomplish today? I know it's Tuesday. I know you're preparing to go back to school. Briefly, how are you doing? How was your day? Thank you so much for sharing out the live. Brittany, I see you liking the live. Maddie, thank you so much for sharing the live. Yeah. Thank God I'm well. Trainings and meetings. Dr. Lewis, those back to school trainings and those back to school faculty meetings, I dislike them. They could be one big email. Send us the info in the email. It's a new semester. It's the same process. I don't know why they put us through that. I know. You know what's crazy? Every time we both have faculty meetings, we always call each other at the end of them, hey, this is what's going on now, or hey, this is what they have me doing now. So yes, we'll definitely talk after this. 4.1K likes. You guys are doing a good job. Thank you so much. Let me hold on, because that 5K that's been creeping up. Hold on, y'all. For those of you joining in, Office Hours with Dr. Johnson. Once we hit 5K likes, we're gonna go ahead and get started. And you guys almost closed out my goal. Thank you so much. Mandy said, I'm meeting the faculty of my program tomorrow. Okay. So it's like a virtual open house essentially. Thank you so much for closing out my goal. It's like a virtual, yeah, it's like a virtual open house where you get to meet the faculty and they discuss their overall course expectations, etc., etc. Students, school is amazing. Stay in school. Don't mind us professors. Trust me, we did well. That's true. Let me set a new goal before I get distracted. Mandy, thank you so much for closing out my goal. Let me see if I can find an interesting one. 4.9K likes. You guys are doing amazing. Thank you so much. Once we hit 5K likes, we're going to go ahead and get started on our trending topic in healthcare. Okay, I just set up a new goal. Perfect. Thank you so much. Okay, we good. You guys are amazing. Thank you so much. So, welcome on in. Office Hours with Dr. Johnson. I hope you guys are all doing well. You guys got me to 5.3K likes. Thank you so much for that. We're going to start off with our trending topic in healthcare. I hope everyone is doing good. I just jumped right into it. How y'all doing? Brittany, how are you? Brittany, did I ask you how you were doing? Brittany, did I check in with you? You guys know in the beginning of the Office Hours, I like to check in with my familiar faces. So I just wanted to check in with y'all before I just jump right into the content, because you guys know I can just jump into the content and get distracted because this is what I'm passionate about. But Brittany, I'm sure you're doing well, and I'm sure you're gonna send me those details after this after this session. Don't forget, okay? So today's trending topic in healthcare is where is that? Oh, improving the overall patient experience. Improving the overall patient experience. In the chat, can we just drop a yes or no? If you've had a positive patient experience that you can recall, that you can remember. Has anyone in the chat had a positive patient experience in the chat? Mandy, thank you so much for writing that. We can pin that after. Has anyone in the chat had a positive patient experience that they can remember? It can be either a couple months ago, a couple years ago, but an overall positive patient experience, either at a hospital or at a small healthcare facility, your PCP office, maybe PCP is primary care physician, or any type of healthcare facility. Okay, I'm seeing some yeses in the chat. Okay, that's good. The reason why this is a trending topic that I want to briefly go over with you guys today is because the patient experience has been an issue for a lot of people. Once again, I'll repeat. The patient experience has been an issue for a lot of people, not just in a specific area or in a specific state, all over the US. There has been lots of complaints. And these healthcare facilities, the majority of them are parent companies. Parent company means that it's one corporation that owns the companies, and they have different facilities spread throughout the United States. Alyssa, welcome on in. We are discussing our trending topic in healthcare, which is improving the overall patient experience. Okay, so there are a couple key points that I found that I want to share with you guys in attempts to improve the overall patient experience, right? So first one, combining drug prescriptions with an app. Combining drug prescriptions with an app. I don't know if we can say that D word on here. F1 in the chat, because y'all know I don't know. I can't keep up with all the guidelines, etc., etc. But the first one is combining drug prescriptions with an app. Why? Oftentimes people complain about access to their prescriptions once they visit their doctor, or once they visit the ER, they have issues. Miss Lovejoy, welcome on in. Welcome to Office Hours with Dr. Johnson. We're just discussing our trending topic in healthcare, which is improving the overall patient experience. And I'm reviewing some key points, briefly going through the trending topic, reviewing some key points. The first key point was combining drug prescriptions with an app. An app can help alleviate the process of confirming your medication, confirming your site of pickup. What is that called? Pharmacy. Lost my train of thought. It's been a long day. Confirming your pharmacy, confirming your medical information to make sure it matches with your prescribed medication, and confirming the delivery overall, right? Another key point, using digital programs to assist in treatment, aka telehealth. Dr. Lewis in the chat said yes, making it convenient. Using digital programs to assist in treatment. The third key point is improving patient to doctor communication. Statistics show that the relationship, the patient to physician or the patient to provider relationship, is important as it relates to the overall patient outcome. So making sure that that communication is A1 essentially can improve the overall patient experience. Okay, let's move along to the next key point, automatic scheduling. Automatic scheduling. If you see that you have a patient that comes in once a month or once every 3 weeks, let's put that patient on an automatic scheduling system. Automatic scheduling. In the chat, they said they are trying to push telehealth with my insurance. There is so much it's going to miss. True. True. It doesn't, it all has its good and bad. And like I always tell you, guys, healthcare is consistently changing. It's consistently evolving. It's never the same. It's always changing and it's always improving. So we have to keep that in mind. Let's move along to the next key point. Routine reminders for visits and follow-ups. Routine reminders for routine visits and follow-ups. Whitney, welcome on in. Long time no see. I hope you're doing well. We are just briefly going over our trending topic in healthcare, which is improving the overall patient experience. Ms. Nini Legacy, welcome on in. We're starting off on our trending topic in healthcare, which is improving the overall patient experience. I've gone through some key points. The first one was combining drug prescriptions with the app. Ms. Keena, I see you. Welcome on in. The next key point that I shared with them was using digital programs to assist in treatment. The third one I shared was improving patient to doctor communication. The fourth one was automatic scheduling. The fifth one that I just announced was routine reminders for visits and follow-ups. It's important to call your patients and remind them of their appointments. Yes, they should know. Yes, they booked these appointments, but that courtesy call helps a lot. And once again, what are we prioritizing? The overall patient experience, right? Last one that I want to share with you guys is the administrator check-in and the administrator communication. So that's me, right? Oftentimes it's said that administrators are so disconnected from their overall staff, their overall patient population. So having an administrator designate time to make their rounds. You know how doctors make their rounds? Administrators should make their rounds, speak to their staff and speak to their patients. Once again, speak to their staffs and speak to their patients. I'm going to briefly go review the key points in our improving overall patient experience. First one was combining drug prescriptions with an app, telehealth, using digital programs to assist in treatment, improving patient to doctor communication, patient to provider communication, automatic scheduling, routine reminders for visits and follow-ups, and lastly, administrator check-in, improving the communication between administrators and their patients along with their staff. Okay, so that's improving the overall patient experience. Okay, so before I bring up our next guest, today's office hour is going to be a little bit different. It's not going to be an interview. It's going to be a discussion with another subject matter expert. So today it's going to be an open-ended conversation. We do have me and this the person who I'm bringing up. We do have a list of things that we want to cover with you guys. We discussed this list yesterday and came up with important topics that we want to continue stressing to the public. So let me go ahead and bring them up. Okay, I sent the invite. Oh, Gifted, I see you. Thank you so much for your support. I see you. Thank you so much. Dr. Lewis, can you hear me? Can you see me?
I can hear you. For some reason, it's not letting me. I don't know. Hold on. Give me 1 second.
Let's get, okay, perfect.
All right.
Perfect.
I am here.
Everyone in the chat, can we get a thumbs up in the chat if the audio is good? Because sometimes when we bring up guests, the audio kind of gets wonky. Dr. Lewis, why you look so excited? I see you.
I see you too, Dr. Johnson. I see
Okay.
you.
Perfect. Thank you, Miss. Thank you, Mimi. Thank you. So
Oh,
like I said, today's conversation is gonna be a little bit different. It's gonna be an open-ended conversation. It's gonna be a discussion between two subject matter experts, one from a health admin perspective, one from a public health perspective. But Dr. Lewis, I know you do want to touch on my trending topic that I briefly just discussed, and you want to touch on your health educator experience, how it relates to patient experience overall. So can you just touch on that? And can you just reintroduce yourself? You know, sometimes we got to continuously reintroduce ourselves here on
no
TikTok.
problem.
Can you just reintroduce yourself to the people them and let them know who you are, what you do?
Hello, everyone. My name is Dr. Lewis, and Dr. Johnson and I met in our Doctor of Health Science program um, a few years ago, many years ago. Okay, and ever since then, we've been friends. We've been friends, and we've been working together and seeing how we could make a difference in various populations, especially minority populations, and how to encourage young people and people of all ages to get that degree. You know, get that paper because we
Mhm.
believe that paper does speak, and also we want to strengthen our community and to know that we're able to make a difference daily. I am Dr. Lewis. I specialize in public health, nonprofit work, community health, and I'm also a professor teaching public health courses. So, Dr. Johnson, you asked me a question on my experience as a health educator in the past at a very prestigious university.
Okay.
I was a health educator, and during that time, Dr. Johnson was speaking about enhancing the patient experience, and I could give you guys an example of that.
Right.
Uh, I was a health educator, and sometimes we would send out our ambassadors to do programming on suicide prevention and food and nutrition health, food and nutrition safety, emergency management, in case there's a thunderstorm or or whatever storm, snowstorm, etc. And many times our ambassadors would go out, but there are times that I went out and we would speak to the students who are our subject matters, who are considered as our quote unquote patients because our center was the wellness center and it was considered a medical home, a group home. I mean, sorry, a medical center.
Mm-hmm.
And we worked in partnership with the health center on campus. And we would help them I would go out and speak to the students and listen to their concerns, and we would collect feedback as well in order to enhance their experience on campus.
Right. And then, can you just touch on your global health experience? That was your experience here at that university in Florida.
Yes.
Can you just briefly
Hmm.
touch on your global health experience as relates to the overall patient experience?
Oh, absolutely. So, um, enhancing the patient experience doesn't only stop in a medical facility. You could do it as you are in a global setting as
Hmm.
well. We have experience in global health. So I remember when I was doing extensive nonprofit work in the past as an administrator, I would do the same thing that I did at the university.
Right.
There were times that we traveled. We traveled to Africa. We traveled to Haiti, etc. And there were times when I would go out on the fields and speak to the patients. We used to do a lot of mobile clinics, and I
Hmm.
didn't want to just be in the background taking care of all the paperwork or setting up flights for the medical missionaries. But there were times that I wanted to go and speak. I wanted to go and translate on the grounds. I wanted to listen to the patient's concern and see how we could do better in the future for other medical missions.
Right. Thank you so much for sharing that. We're going to jump right into it. Like I said, today is not going to be an interview. It's going to be a discussion. We have a variety of topics, a couple of topics, key points that we want to stress and share our overall experience and perspective on with you guys on here. Let's jump right into it. Dr. Lewis, yesterday we discussed the benefits of telehealth and
Yep.
pushing it in the workplace. So the workplace for us is either small healthcare facilities or large hospitals or large public health programs, but the benefits of telehealth and providing interpretation services. I'll let you start it off.
Oh, absolutely. We know that we're living in a very advanced technological world, and we're so busy with many things. We know
Right.
that, single mothers, the elderly, there are vulnerable populations,
Right.
people, individuals who struggle with social skills, social anxiety as well. Some people have a fear of driving, some people have a lack of transportation. So,
Mhm.
all these things are the reason why telehealth, apart from COVID, became so advanced and so common in various facilities. And one thing I do encourage is in order not only for doctors to see more patients, but to allow flexibility for the patient, telehealth services are key to not only increasing the well-being of the individual, but also improving the quality of life of the population. Since we are in public health and we focus on the health of the populations, we see, based on statistics, we see the benefits and we see how many people are receiving it positively. You could even do physical therapy at home now.
Right.
So it's really really beneficial. Oh, Nini Legacy said, "I love my telehealth appointments."
Yeah, I didn't want
Yes,
to.
they are very beneficial. Sometimes you don't have time to run out to go and see the doctor for 30 minutes.
Exactly.
You have to really factor in an hour and a half to 2 hours. But if you could just on your lunch break talk to the doctor for 15 minutes, you'll
Mhm.
get better results and better communication. You had talked about telehealth services. I remember doing my doctoral internship, how that was a problem because it does limit the population
Right.
that you are able to serve. The doctoral internship that I did was for substance abuse detox patients. If you
Pause.
didn't speak,
We don't get into that. Don't touch too much on that. Remember what one of our topics is.
all
Thank you,
right.
Chris. Actually, I didn't want to cut off my speaker, but Dr. Trish, welcome on in. Dr. Lewis, Dr. Trish would be a great person for you to connect with as well too. I think she said
Oh,
she's also in the public health space too. But Dr. Lewis, the internships, that's one of our topics. So don't just briefly go over that. What you was about to say.
sorry, a call was coming in, so you're gonna have to. I heard you say I should connect with Dr. Trish, but I
Yes,
didn't hear
I was
call.
telling you the internship. Don't touch too much on it right now because that's one of our key points
Right,
after to
right.
align with the right. So briefly go over because I see you was about to get ready and tell us what you did for your internship, but we saving that for towards the end. Mhm. You get it?
Okay, sounds good.
Sounds good. Let's continue on providing interpretation services within large healthcare facilities. Okay, part of my dissertation, I touched on the importance of cultural competency for healthcare professionals. As we know, I've been stressing that on here. That's what my niche is
Hmm.
on. That's what my passion. That's what I'm passionate about. Cultural competency for healthcare professionals overall, right? And in dissecting cultural competency, interpretation services falls into place. Why? Language barriers, especially
Hmm.
for a state like Florida. I'm in South Florida. We all know
Hmm.
South Florida is a melting pot. We have
Hmm.
Hispanics, we have Americans, we have Haitians. It's the our main languages here in Florida. I'm just talking about Florida. Is
Right,
English, Spanish, and Haitian Creole or French.
right.
Okay. Welcome on in, DMP Psych Doc. I see you. Welcome on in. So the importance of interpretation services in all healthcare facilities is key. It's imperative.
Hmm.
And if we want to continue improving the overall patient experience, we have to make sure that we have accommodations, a diverse patient population. Okay, these are some key words that you guys have heard us constantly say on here: patient population, cultural competency, improving the overall patient experience. Do you see how healthcare is collaborative? Do you see how healthcare, it can be repetitive, but it is collaborative? Why? Because healthcare is continuously improving, healthcare is continuously innovating. Okay, so I want to touch on the next topic, Dr. Lewis. Okay,
Hmm.
is a master's degree important or is it required? You guys don't know how many messages I have since I've been posting up the my videos on different career paths to pivot into. I get loads of messages. Do I need a master's degree? Is it important? Can I still get a job with a bachelor's degree and years of experience in healthcare or in public health? Is a master's degree important? Is a master's degree required? Let's hear from you, subject matter expert.
Um, yeah, highly recommended, but not required.
Repeat
Why do
that.
I say that? What is a master's degree? Once you get a master's, it shows that you have mastered the information. And for
Exactly.
that reason, you are able to stand out to employers or to various healthcare facilities, showing that you basically know your the proper training to really uh, to really not only enhance the patient experience in the workplace, but also you are able to reach the missions and goals of the organization and what they're looking for. So I always encourage people to get, the higher that you could go on the ladder, go for it. Not only that, your pay is higher too when you have a master's degree. We can't just close our eyes. You want a better, it has been proven, and we teach our students this all the time,
Mhm.
that the higher the education, the higher the quality of life, and the better the income. So
Exactly. So whenever I
I
get that,
recommend it 100%.
same here. I'm going to piggyback off of that too. Before I do that, Dr. Trish, I see you sharing out the live. Thank you so much for your support. I'm going to piggyback off of Dr. Lewis. I second that as well. That master's degree is not required, but it is needed. If you want to advance, it is needed. If you want to stand out within the application pool when you're on the job hunt, it is needed.
Right.
The majority of us here, we are black and brown. Okay.
Okay.
And our white counterparts, oftentimes they get promoted more easily than the black and
Mhm.
brown. Let's just keep it 100. Let's just keep it a buck, right? Let's keep it
Right.
100,
Right.
right?
Right.
It is needed if you
Mhm.
want to advance. Thank you so much, Dr. Trish, for the popular vote. Okay. Now, one thing I do want to share on that: the master's degree, the majority of them, you have to have you have to complete like a capstone project. Different programs have different names: capstone project or a required internship.
Right.
Um, I did mine on what are some strategies to implement into healthcare facilities to alleviate nurses' burnout and maintain positive levels of emotional intelligence? I did that research at a level one trauma center for HCA Healthcare. To
Mhm.
this, I did that about 5 years ago. To this day, when I do interviews, they still ask me about that research. My interview for me to become a professor, the interview panel, that was one of their main questions they asked me and wanted me to dive more into it. Why? Because they said that once they hired me, they wanted me to do something, create a program, a clinical internship program for their health management students that they were hiring me to teach. So, to reel it back in, it may not be required, but it is needed. It may not be required, but it is definitely needed. Okay. Dr. Lewis, can you just briefly touch on what your overall capstone project was for your master's program, if you remember?
It was a while ago. I'll get back to you on that.
Okay.
I have to go back and look because I tend to confuse it with my doctorate program.
Yeah,
So
I know.
I'll
Okay.
go back. That was many years ago.
Next up, we're doing professor tips a little bit differently today.
Mhm.
Dr. Lewis and I are both going to be sharing our overall perspective and experience on the professor tips. I know my moderators, they did receive the professor tips, so you guys can still drop them in the chat for us, but we're going to go through our professor tips. Okay, so the professor tips is geared for those of you who are new here. My office hours are broken down into three sections. The first segment is trending topic in healthcare. The second segment is an interview with a guest, but today is going to be an open discussion with another subject matter expert. And then the third segment is ending it off with professor tips. And all these professor tips can range from a variety of different topics. Today's topic, it is geared for graduate students going back to school. We're in August. We're all approaching back to school, either a professor a student, we're all preparing to go back to school either this week or next week, okay? But today's professor tips are geared for graduate students, those who are working on a master's degree and you're starting the new semester next week, or those who are possibly considering a master's program and you're thinking about your program or thinking about when to start or thinking about, hey, if I start, will I be able to manage? What do I do? How do I do it? You know? So that's the first key point we want to share. Checking in with your advisor. It's important to check in with your advisor, okay? I know advisors do get a bad rep. There are some great ones out there. Dr. Lewis, can you share the importance of checking in with your advisor? We got to check in with the advisor.
Oh yeah. Checking in with your advisor is crucial to making sure that you are on track to graduate.
Right.
Many schools are pushing students to complete their courses in 4 years. So please check in with your advisor. You may have additional courses that you thought you didn't have to take, and it's through a meeting that the professor says, you may have to take this in the summer in order to graduate next year, or you don't want any surprises. That's the main reason why it's important to check with your advisor. Also, if you're considering grad school, okay, please, there are many opportunities that your advisor can link you with. They have so many resources, and also your college tuition pays for the advisor to work for you. So use it. I remember what I did for my master's now.
Okay, sure.
And that's probably the reason why I got hired at that very prestigious university as a health educator. Sorry to reroute, but I was looking at the importance of the wellness center for college students. So I was basically I was being trained as a health educator in the wellness center and understanding the importance of wellness as a student. So where I did this, the way you said that they were hiring you as a result of your work in your master's program, during your master's program, that's how I got hired as the health educator at that university, because that's where I did my internship at that university. So I had already had this experience, and as a result, I got the job.
I like how you tied that back in and showed the importance of going back to school. It may not be required, but it is definitely needed for advancement.
Yes.
It is definitely
Oh,
needed
absolutely.
for more opportunities. It is definitely needed. Now, we're not saying that there aren't jobs out there that say, hey, bachelor's degree required and 5 to 10 years experience, right? However, if you have a master's degree, it'll be master's degree and maybe 2 to 3 years experience. But that master's degree can knock off a couple of years of that required working experience. Now, same thing with a doctorate degree. I've seen jobs that said a doctorate degree, a PhD, a terminal degree. A terminal degree is a doctorate or a PhD. A terminal degree is the highest degree in a specific subject niche that you could have, terminal degree, but it also means PhD or doctorate. I've seen job postings where it was a PhD and 0 to 1 years of experience, of related experience. So that doctorate degree would knock out all of that required working experience. Why? Because they appreciate you going back to school and gaining that subject matter expertise. Training. Okay? Once again, it may not be required, but it is needed. Let's continue. The second one, familiarizing yourself with Canvas and Blackboard. Lots of different programs use different ones. My school uses Canvas. Dr. Lewis, your school uses Blackboard, right?
Blackboard.
Familiarize yourself with Canvas and Blackboard. Some of you have been out of school for quite some time. LMS has changed. What is LMS? The Learning Management System. What's a Learning Management System? Canvas and Blackboard. Those are the two main ones that the majority of U.S. colleges use, right? Just Canvas and Blackboard.
Yes. I just want to make a note, Dr. Johnson, that some universities are upgrading to Blackboard Ultra.
Oh, yeah.
And it's a platform that uses AI. So please check in with your university to see if Blackboard looks different or if Canva looks different.
Because like healthcare, those LMS systems are constantly changing, constantly evolving. Welcome on in, pals. I see you. We're just talking about professor tips in healthcare. Today is not an interview. It's an open discussion with Dr. Lewis, a familiar face. Thank you so much for that gift, Jazzy. Checking your emails. Okay, so
Mm.
familiarizing yourself on Canvas and Blackboard, it's important to check your emails. Check those student emails. Once again,
Mm-hmm.
I repeat, check those student emails. The majority of the
Mm-hmm.
time, us professors, we don't have your email. We have to dig deeper into a separate system to find your personal contact email. It's a
Yup.
lot easier for your professor to reach out to you through your student email that we could send a mass email to. I know, you know how many times students have told me, "Oh, Dr. Johnson, I don't check my student email. I don't check my student email." That's where I send updates. That's where I send, "Hey, why did you not show up to my class? Hey, you're
Mm.
failing. We need to talk."
Yep.
Check
That's where we post classes canceled too.
exactly. And then
Or classes online if you're in
right,
person.
check your student email.
Check
Link
check
your student
Blackboard.
email to your phone. That's another excuse I get. Dr.
Yes.
Johnson, I don't have my student email linked to my phone. I only have my Gmail or my Yahoo. I only have cutiebaby98 at yahoo.com on my phone. I don't have John Smith 14 at such and such.edu, you know?
Yep.
Check your student email, familiarize yourself with Canvas, familiarize yourself with Blackboard. Everyone here, we are discussing professor tips geared for those who are in graduate school. That's starting next week or this week or next week. I think obviously all programs are different. So some start this week, some start next Monday. Let's
Can I
continue
just
on.
add a couple of
Oh,
things, Dr. Johnson?
yes, ma'am.
There are announcements on
Oh my
Blackboard
gosh. And the
and
announcements could be
Canvas as well.
right. It could be
There
linked
are
to the student
emails.
email.
Huh?
It could be linked to the student email. Yes.
The reason why I'm emphasizing it is some students haven't turned on the notification to
Okay.
get those notifications on their student email. So please, please, please check with your tech support on campus to make sure that all the notifications that are going through Canvas or Blackboard are getting to your email. That's why students show up and be like, I don't know that class was canceled, or I didn't know it was online, and then they get pissed off. But yeah, we post these
Right. And they
things.
show up to class and want to contact and want to they show up to class, a canceled class, and want to contact our dean. Hey, our my professor is not here, and they're 30 minutes late and trying to get us in trouble. Let's move right along. We're going to check our email. We're going to familiarize ourselves with Canvas. We're going to familiarize ourselves with Blackboard. Familiarize yourself with your school's LMS, Learning Management System. Let's continue, Dr. Lewis.
Yes.
Pre-order your textbooks or your PDFs or your ebooks.
Mm-hmm.
Pre-order your textbooks. Now, let me tell you something.
Pre-order.
From experience, you can order your textbook, yes, but the ebook, you get it instantly. Just as
Yes,
long as you have the funds, your ebook, you get it instantly. Now, I know
instantly.
there are some people on here who like a tangible book, a tangible item. However, when you are studying or when you are doing your open book exams or quizzes, you can do control find on your ebook and instantly find the specific topic that the question is looking for. So
Right.
that's why I always, for me, when I was a student, I always leaned towards ebooks
Right.
because I could find information a lot easier, a lot
Mm-hmm.
faster versus an
Mm-hmm.
actual textbook where I'm sliding through pages and I only got 45 minutes left on a quiz.
Right. Right.
Pre-order your ebooks or pre-order your textbooks, whatever you are comfortable with.
Mm-hmm.
Pre-order them books. Once you get your funds, pre-order them books, right?
Yes, students, you could go to the library. They have the WorldCat system where if the book is not available at your university, they
Right,
could get it from another university.
right.
So use those to your advantage, but don't show up in the on the first week of class saying you
Don't have
just
the
ordered
book.
your textbook this week, and WorldCat will take 3 to 4 weeks to get your textbook when the first quiz is in a few weeks or the first exam is in the first 6 weeks.
Or when
So
you have,
um,
or when you have an exam or a quiz on the first day of school for us to kind of gauge where we need to start within the
right,
lesson,
right,
but you
right,
don't got the book.
right. Some
Uh,
school libraries have the ebooks readily available for you. You could search online to see if the PDFs are available,
mhm.
and you could buy cheaper ones on Amazon or other booksellers, or even rent it for cheaper.
Do you
So,
guys see where we had this? Why I had this office hours dedicated for this topic today? Do you see what Dr. Lewis and I are about to embark on come next week? I did a video a couple months ago about the duties of a professor, and
hmm,
they're in the comments. Oh my gosh, I didn't know this. I didn't know this. It's a lot. We're teaching these students, but we're also somewhat babysitting them. You know,
Work with us, guys. Work with us.
work with your professors, please. Let's continue,
Yes.
Dr. Lewis.
Yes.
I'll let you start this one off. Use your campus resources, and this is for our on-campus students and our fully remote students. Use your campus resources. Thank you. Locate and utilize your campus resources. What you got to share, Dr. Lewis?
You pay for it all, so use them.
Exactly. No.
You're paying for it. Whether you see it says free at the top,
Mhm.
trust me, it's coming from somewhere. It may
Exactly.
not come from your pockets, but it will come from someone else's pockets. So please, please use your resources on campus. I just want to point out a few. Use the gym. Most schools have a university gym. Use that so you don't have to pay an arm and a leg for some, LA Fitness. Number two,
The big store.
you some of those universities have showers too. So if you need to take a quick shower
Yep.
before that 6 p.m. class, hey. The other thing too
Bookstores. Bookstore.
is the food pantry. I remember
Yes,
when
the food pantry.
um excuse me.
So I was saying the bookstore, but yes, the food pantry. Sorry.
Yes, the
Continue.
bookstore. Everyone knows the
Yeah,
bookstore.
but continue.
But the food pantry, if you are short on cash, the food pantry is for you. Okay, usually we always hear of the broke college students,
Right.
but the food pantries usually have very good things in it. I remember when my sister was in college, she would go to the food pantry. She would get her peanut butter, like her various proteins, for the week. So they tend to have really good stuff there. Um, um, and don't be embarrassed to use these things. And sometimes if you are feeling a little off, I'm just being real. If you're feeling a
Mhm.
little embarrassed to go to the food pantry in person, they could work with you and you could pick it up elsewhere.
Exactly.
So you could contact them, tell them how you're feeling. You could work alongside the social worker and the counseling center, and they help you take care of those situations too. People don't have to know your business. Okay.
Exactly.
Um, the other thing is counseling. Remember, counseling. A lot of times this subject is taboo. As someone who worked in a counseling center, I want to tell you that yes, your mental well being is crucially important when you are in school.
Right.
And the other thing too is they don't only counsel students who are going through tough times, they also show you study tips.
Mhm.
They help you
Best
cope with
practices.
any situations that you are dealing with.
Mhm.
And if for some reason you don't feel safe for any reason, please contact them. They're there to help you. The last place I would say is there's another thing. I would say campus safety as well. Contact campus safety. You see a bag lying there that you, after an hour, no, it has not moved. Call campus safety. For example, see something, say something. So you see something, contact campus safety. And the last place I would say is apart from the library, tutoring center.
Okay.
My my a what's the format that we use? Anthony, help me.
The what? The TA?
APA format
Oh my
writers,
gosh.
please.
I'm
My
triggered.
APA format writers, please go.
Let's not touch on that. I'm triggered. I know it's gonna start next week. Last one that I want to share with you guys. Kim, I see you. Welcome on in. We're
Welcome.
discussing professor tips. This specific professor tip that we're discussing is locating and utilizing the campus resources. Dr. Lewis just went through a variety of different resources that are available on campus for both remote students and on-site students. The last one that I want to share with you guys that's very important. Let me lean in and get closer. If you have, yeah, because I'm real serious.
I know you are.
If you have a disability, if
Yes.
you have any
Thank
type
you.
of we don't have to use the word disability over here. If you have a unique ability, okay,
Mm-hmm.
that sometimes hinders you from learning,
Right.
or maybe you need special accommodations.
Mm-hmm.
There is every It is required legally. Every higher education institution has
Right.
a department for student accommodations,
Right.
specific student services. Each college has a different name. I can't
Right.
remember the acronym for mine, but this is a long name, but it's essentially accommodations. Okay. One thing I want to stress to you all:
Office of Accessibility.
Office of Accessibility, and you know they have different names depending on
Right.
the funding, et cetera, et cetera. Okay.
Right. Right.
You guys, if you reach out to these resources because of your unique abilities to assist you in succeeding in said courses, that will not show up on your transcripts. That will not show up on your degree. Such and on your transcripts, it will never say such and such received an additional 30 or 45 minutes on each exam. On your diploma, it's not going to say such and such attained their bachelor's degree, and at the bottom, utilized student accommodations, utilized student accessibility services. You see in healthcare how we have HIPAA, we have to follow HIPAA and protect patient information and patient rights. Same thing. The same thing. Once again, the same thing. You guys don't know how many students reach out to me and say, Dr. Johnson, I don't want the accommodation services to end up on my transcripts. Dr. Johnson, I don't want that to end up on my degree. I look at them like, what? So you just want to sit back and fail the class. So you want to sit back and fail the class. Pivot with Tiff, welcome on in. We're discussing a trending topic we're discussing Professor Tips and utilizing campus resources. Thank you for coming on in. You guys don't know how many times students tell me, Dr. Johnson, I did not reach out to them. I do not want it on my transcripts. I do not want it on my degree. So Dr. Lewis and I are here both to debunk that. If you utilize student accommodation services, it does not show up on your transcripts. It does not show up on your diploma. Utilize campus resources. You
Yes.
are paying for them. You are paying for them. Okay?
And can I add one thing?
Please add
Your
one more.
family will not know if you don't let them know.
Hey,
A lot of times students are afraid of what will my mother and father and cousins and etc. think.
exactly.
But your privacy is your privacy. Once you get into college, you're a fully blown adult. And if you don't give permission to the university to release that information to family and friends or whomever, they are not allowed to release it so that your laws are protected.
Exactly. Your
100%.
your privacy is protected. Pivot with Tiff. I think you in your bio, I think you have it listed that you are working on a DHA. Congrats on that.
Congratulations.
After that, Pivot with Tiff. Today's Professor Tips is dedicated to students like you who are going back to graduate school. Since you just joined on in, I just want to briefly go over the ones that we already discussed. The first one was checking in with your advisor, continuously checking in with your advisor. We know advisors have bad reps. Please continue checking in with them. The next one we shared was familiarizing yourself with Canvas or Blackboard, depending on what your program uses. Familiarize yourself with Canvas or Blackboard, and also continuously checking your student emails. Our students are constantly telling us, Dr. Johnson or Dr. Lewis, I don't have the student email linked to my phone. Link it to the phone.
Right.
Next one we shared was pre-ordering your textbooks or your ebooks. I prefer ebooks so we can control find. When you have them those open book exams, control find the answer, right? The next one we shared was utilizing campus resources. That's where you jumped on in, Tiff. Utilizing campus resources. There's a variety of campus resources that are available to students. You guys are paying for them. Utilize your campus resources. Now, the last one I want to share with you guys is researching your internship topic and or your site. Don't wait till the last minute. Kind of have an idea of what you want to do, how you want to do it, because it's a big project. That master's research thesis. Remember I said earlier on, different programs have a different name. Some call it capstone. At FIU, where we went, they call it the master's research thesis. Remember, Dr. Lewis?
Right.
So I want to share with you guys my research thesis for my master's program, and then I want to share with you guys my doctoral mini dissertation. My research.
Dr. Johnson, I think Pals had something she wanted to say before you continue.
Pals, you good? I didn't reach out because of my false confidence in my ability to manage time. Pals, I'm gonna just keep it 100 with you. I like how you. Thanks for the transparency, and
Hmm.
here in the office hours with Dr. Johnson, it's a safe space. So I'm just gonna address you directly. If you are in therapy right now, if you are seeking therapy, and your false confidence in your ability to manage time, that can fall under anxiety. Have your therapist write you a letter. You bring that letter to the school, and you can have an additional 1 hour per exam.
Hmm.
With that letter from your therapist, you can have an additional day or two to complete that one exam
Right.
continuously throughout the whole semester.
And you don't have to take it in the classroom.
And you don't have to take it in the classroom. You can choose to take it in the classroom, or you can choose to take it in the designated area that they have for the special
Right.
accommodations. What you don't know, you don't know. What you don't speak up, you don't know.
Hmm. And all these things help to build your confidence. All the
Exactly.
resources on campus help to build your confidence. So
Exactly.
the first, I always say the first sign of strength is admitting that you have a problem.
Acknowledging, right?
So acknowledging that you have an issue. So thank you for your transparency,
Right.
and you can keep going, Dr.
Pals,
Jones.
pals, what you don't know, you don't know. Okay, so
Right.
going forward, if you have, just like how we could do FMLA, or we could go to our therapist and they say, oh, go get a letter from your therapist and bring it to your job and tell them you need like a mental health sabbatical. You can do the same thing to the same route, but it will just be special accommodations as it relates to education, which is extended time or additional days to complete assignments or projects. Utilize the resources, and they do not look down upon people who utilize those resources. Once again, the school or those programs do not look down upon students who utilize those special accommodation resources.
And if
Why?
they do, they get fired.
And if they do, they get fired. Why? Because every student learns at a different pace.
Right.
Every student learns at a different pace.
Hmm.
Okay?
All right. Keep going.
Yeah, let me
You were
keep
talking
going.
about the thesis.
Here with
Thank
Tiff,
you.
thank you so much for sharing the live. I see you. Pals, and I'm sorry, the chat is going, so sorry I missed that. Okay, pals. Um, internships. I did my master's research thesis on what are some strategies to implement into healthcare facilities to alleviate nurses' burnout and maintain positive levels of emotional intelligence, right? I think I said that earlier on, but just to say it again, I did it at my current employer. Yes, certain programs will allow you to do your research thesis at your current employer if it fits. At that time, I was working at HCA Healthcare. The majority of us have heard of or seen an HCA Healthcare hospital within our neighborhoods. It's a major parent hospital corporation. I did it at HCA Healthcare. It was a level 1 trauma center, and I was able to interview nurses in the OR. I interviewed nurses in PACU. PACU is post acute care unit. I interviewed nurses in the pre-operation unit. That's the unit that they prepare patients for surgery. PACU is a unit that you, right when you come out of surgery and you're waking up from the anesthesia, there's a nurse that wakes you up there. So I interviewed 3 nurses who were all working within 3 different specialties that were able to provide to my research that I was collecting. Then I did my dissertation and educational product on cultural competency for healthcare professionals, and I created a course, a bachelor's level course that was geared for healthcare administration students like me and nursing students to be culturally competent and to know how to treat and work within diverse patient populations. I just didn't the semester that was due, I didn't just start that semester and did it. That was couple semesters prior, working on it slowly by slowly up until it was time for it to be due. Don't just jump start that semester and thinking you're going to start your dissertation or start your research thesis. Dr. Lewis, take it away. You can start off with your research thesis for your master's program and then your dissertation.
Uh, I did my research during my master's in public health at FIU, my alma mater, on the importance of wellness as a college student. And I was looking at the various programs that were offered to the students on campus
Right.
and seeing how it benefits them in the long run as they are completing their studies. Um, the doctoral program.
Mm-hmm.
So the doctoral program, I did my internship at at where we looked at the importance of nutrition as you're going through substance abuse detox, and for student for patients, their substance
Dr. Lewis, it
abuse
got cut off. Can
detox.
you share where we didn't hear where you did your internship at? It got cut off. Your audio. You're on mute.
Sorry.
Okay, we can hear you now. We hear you.
Okay. So sorry. I keep getting a call. If they call one more time, I'm gonna have to pick up because they already called me like 5 times.
Sure.
But yes, I was completing my internship, my doctoral internship as at a subs.
Mm-hmm. She'll be right back, you guys. So for those of you on here, we were discussing the internship topics and the sites and the importance of solidifying what you want to study, what you want your topic to be, who you want to interview. Don't just wait until the last minute. Tyra, welcome on in. I see you. Today's topic, we're discussing going back to school, tips on going back to school. We discussed a variety of topics for telehealth, master's degree. Is it important? Should I get it? And we also discussed a trending topic in healthcare, which was improving the overall patient experience. So far, oh, I didn't even see that, Mandy. I'm already looking into places for my field work and instill over a year out for exactly. You have to. Now with you doing social work is broad as well too. You could do a variety of topics. It could be you could do in a hospital, you could do in a private facility. Social work, you could do within public health, you can do it within government, social services. There's a variety of areas that you could do your field work. Your field, for those of you who don't know, field work, they're in the social work program. Just like how in our program we have clinical internships or administrative internships, in social work they have field work or clinical field work that they have to complete in order to get that degree, in order to graduate. And then once you go over to the master's program, in order to sit for your exam, that's part of the educational requirement. So just like health admin and public health, social work is broad too. Once again, I'm going to repeat: in hospitals, public health programs, social services within the government. Social work is very broad. So that's good that you're already looking into where you want your field work to be overall. Dr. Lewis, are you good?
Yes, I'm back. I'm so sorry, guys.
No problem. Yes, it's
Yes.
very broad. Tyra, I see you. Tyra, we discussed a variety of topics before we ended off. I'll just go through them briefly for you so you can get those gems as well too. But Dr. Lewis, can you start off? We heard where you did your master's program. Can you share with us what you did for your doctoral program, the dissertation, and what you studied, who you interviewed, what was your main research?
Okay, my doctoral research, I actually did 2 projects during my doctoral years.
Overachiever. I know. I see you, overachiever.
The first one was that I was talking about before was substance abuse detox, the importance of nutrition for
Hmm.
substance abuse detox patients. Many times these patients do not work, so I was working at a medical facility, and I was interviewing the patients and just getting an idea of their lifestyle. I created a program where they could get access to nutritional resources in the community,
Hmm.
to get DSS, so that's Department of Social Services, access to the resources available through the Department of Social Services, and we're in the area had different soup kitchens or food pantries, etc., etc. So I implemented that program within the substance abuse detox facility.
Nice.
A lot of them, they live on $1 or less a day. As I said, many are homeless.
Hmm.
Many have comorbidities, which is the exist having types of illnesses. It can be a mental illness, a chronic illness. So, for example, many of them had comorbidities, so many of them weren't able to work and get those nutritious meals on a daily basis. The program was 2 weeks longer for those who had more severe cases.
Hmm.
It would be a little longer, but the average amount spent was 2 weeks. For my other for my other internship, what I did was the importance of engineering students in Haiti taking public health courses. Many times they need to be aware of how their work in the field of engineering and construction has an impact on the populations surrounding the construction work. So
Right.
many times they don't think about the health impact, the impact of the health of the populations. They
Mhm.
just go into construction. I know there's a few requirements as it relates to zoning, but are they thinking about how much population, excuse me, pollution that could
Affected, right.
occur due to the fact that they are breaking ground and cutting down trees and so I think that uh, engineers and construction workers really need to take a course so they could be aware of the impact. So they work towards lessening the impact they make health wise on the population. So
And
those were my two
for those
projects.
of you here, what is that called? That's called either environmental health or occupational health.
Right, right, right,
Once again, what is that called? Environmental health or occupational health. And that's
right.
another career path within public health or
Mm-hmm.
within health administration that one can pivot into. Environmental health or what else? Occupational health. Okay.
Occupational health.
Um, Dr. Lewis, there are a couple of people who I see on in who are joining on in. What would you say to somebody who wants to gain experience within health administration or public health? Where should they start? Let's say they were a medical assistant, or let's say they've had like one job at a hospital front desk. Where would you say are some good ideas for them to start off to gain some additional healthcare experience to start off entry level?
Following your page. One of the big thing
Why
is
I asked
having
if I was-
conversations with. Say that again.
Sorry, I was talking to somebody in the chat. I was saying Tyra. That's why I asked because I see you, Tyra. Continue. I'm sorry.
Yes. So, all jokes aside, having conversations with people who are already in the field, evaluating, evaluating your strengths, your weaknesses, things that you are interested in.
Right.
So, doing a self reflection on yourself to know what you like and what you don't like.
Exactly.
And also, I always encourage people to go to those seminars, go to those webinars, go to those conferences. Step out of your comfort zone. Doing an internship, elsewhere. Um, going to community health events. So these are pretty much the baby steps to set the foundation for what you want to do. For those who are students who are starting off, there are intro level courses that you could take as a elective
Medical
in
terminology
various.
is one. Sorry to cut you off,
Yeah,
but
no problem.
medical terminology is one.
Right.
Mm.
Intro to health promotion, intro to health administration, all those intro to healthcare. All these courses are good for you to take. Some students even do
Yep.
minors in the program. If you are in a master's program that is not healthcare related, there are professional certificates that could complement your degree that you could get. You could take, like, it's like the minor of the master's degree. They're called professional certificates.
Right.
You could take it in dietetics. You could take it in public
HR,
health promotion.
human resources.
Right, right. So health, I we know that health is interdisciplinary.
Hmm.
So everything that you do has an impact on health, whether you
Everything.
will run into it regardless of the work that you do and the field that you enter. So it's always good to learn about it before
Exactly.
entering a field.
And to end it off, y'all saw me scrolling through the pages of my notebook. I wanted to find there. I did a video months ago on some skills to add to your resume. For those of you on here, we're always looking to update our resume or what to add. Okay, staffing. I'm just going to briefly go through them. some of the things you guys are doing at your jobs, you guys don't know how it could be a transferable skill. Okay, so I just want to briefly go
Right.
through these before we end it because I know we kept you guys for at least over an hour. Staffing and scheduling, budgeting and financial management, electronic health records management, data analytics. That data entry, that's data analytics. Put it on your resume. Okay, project management. Did they assign you a project? Did they assign you a special assignment? They had to call it special project. Did you get assigned that? No matter, even if you were a patient rep, even if you are a data entry clerk, even if you're a medical records coordinator, did you get assigned a special project? You can put project management on your resume. Implementing policies and procedures. Did you assist them in rolling out a new procedure or a new policy? You assisted them in implementation. Okay. Last one I want to share, which is important to both of us, cross cultural communication and competency. You take a class like what I teach with Dr. Johnson, cultural competency in healthcare professionals, and you get experienced in the field.
Hmm.
Cross cultural competency and being culturally competent and aware in
Hmm.
how to treat and work within diverse patient populations. Okay. I hope you guys took notes today. I hope you guys received these gems we dropped. Before we end it off, I another reason why I dedicated this live like this was because Dr. Lewis here is going to start going live on her own. I'm sure a lot of you on here know that people always get those. Thank you, moderator. I see you in the chat. You see, people always get those jitters on going live. So I had a conversation with Dr. Lewis here, and I was telling her, just go live, just go on there. The people that are going to like what you got to say. So today's live was just another introduction. I want to make sure that we are familiarizing Dr. Lewis's face. For those of you who are interested in public health, for those of you who are interested in nonprofit, for those of you who are interested in social services, for those of you who are interested in health education, Dr. Lewis is your go-to person. Dr. Lewis is your subject matter expert. Please remember to follow her. She's going to work on a schedule on when she wants to go live with you all that aligns with her work so she could dedicate time to come on here and teach you guys and continue to drop gems. And Dr. Lewis and I are going to continue collaborating and working together. And we are working on a great project that we haven't announced yet, but we're working on a project. You guys know we're continuously working, continuously putting you guys first, and continuously providing subject matter expert information and acquired skills and knowledge on here because if we could do it, you guys can do it too. Once again, if I can do it, you can do it too. That's why I'm on here doing what I'm doing. That's why I'm on here sharing the information that I'm sharing.
Don't give up, guys.
Do not give up.
Keep
Dr.
pushing.
Did you have somebody like you and I 5, 6 years ago doing this?
No.
Me neither. And people often ask me, what is your purpose? That's my purpose. I didn't have a Dr. Johnson. I didn't have a Dr. Johnson 5, 6 years ago.
Mm.
And I wish I did.
I wish I did too. Yeah.
I became that Dr. Johnson and Dr. Lewis
Right.
became that Dr. Lewis.
Right. Right.
Anyways, though, we are reaching a little over an hour. All of you guys who stuck around, thank you so much. I did have a goal. I only have two more. For those of you who don't know, 8 is my lucky number. So all of my gifts are always in eights. So if you can we close out my goal? I only have two more things left to reach the eight. So I don't even know the words, y'all. Y'all know I'm still learning this TikTok business. Two more things to close out my what's my live goal. Two more. What is this icon that I chose? French fries?
It looks like French fries.
Oh, it's perfume. Two more, just
Perfume.
two more to close out my goal. Dr. Lewis, thank you so much for your perfume. Thank you, Tyra. I don't know Tyra. Dr. Lewis, thank you so much for taking the time to come and have a discussion with me. Any closing remarks? Where can they find you? What do you want your page? Can you let them know what you want your page to be dedicated about, or what can they look forward to?
Sure. As I always tell people, everyone has a story. So never think that you don't belong in that space. So that's my advice to so many people, to everyone. That's my advice to everyone. The other thing too is Dr. K Lewis is my page. Uh, we're going to be working together, collaborating on public health topics, cultural competency, nonprofit, global health, which is my area of expertise as well, and where you guys could get more resources to continue on with your goals and your aspirations. So stay tuned.
Definitely. Thank you so much for sharing that. And just to bring it back into the interview style, as you are preparing to go back to school, how are you maintaining your mental health overall?
You mean as a professor?
How are you maintaining your mental health as you prepare for your new semester that you're going to be teaching? Is your mental health up to par, or what are you doing to make sure that your mental health is up to par so that you are fully equipped and prepared to teach your hundreds of students?
I am resting. Resting is important. I'm preparing my schedules ahead of time. We're going to start diving into the content for the semester,
Mhm.
updating content, adding new content, so I could be fully prepared for the semester. Um, Doing just organizing and asking for help.
Right.
Today, I reached out to my sister. I realized that I was a go getter and everything I do, I had to, hit the ground running and everything. But I was like, I don't have to do that. I could ask for help. So yeah, that's what I'm doing.
Nice, perfect. Thank you so much for sharing that. Once again, you guys, thank you so much for stepping into office hours with Dr. Johnson. Um, I do have a project in the works that I'm currently working on that I will be announcing soon that I'm excited about. I do have a project that I'm working on with Dr. Lewis that we are both excited about. So please just continue to check out our page, subscribe to us if you're not already subscribed to us. Thank you, Mandy, for those stickers. Um, Stay tuned. Stay in the loop with Dr. Johnson. Stay in the loop with Dr. Lewis. We have a lot to say. We have a lot of information to share, and we have a lot of gems to drop over here on TikTok outside of our everyday classroom. So, once again,
Mhm.
thank you so much for joining. Thank you so much for sticking around. Thank you so much for engaging and supporting two young professionals who coming on here and got some things to say. Okay.
Mhm.
I
Yep.
see you. I see you, Tyler. Thank you so much. Thank you so much for your support, Tyler. And Tyler, just so you know, I'm not that active here on Instagram, but I'm a little bit more active here on TikTok. So if you ever need information or resources, you could always send me a message over here on TikTok, Tyler. Keep in touch and never, like I tell everybody, you guys are not bothering me. You know how many times people message me and they're like, Dr. Johnson, I don't want to bother you, but what would you, or hey, Dr. Johnson, can I have your advice on that? You guys are not bothering me. Send me a message here on TikTok. Okay? Okay, you definitely real perfect. Everyone, thank you so much for closing out my goal. I go twice today. I appreciate your support. I know you guys love our gems, so I know you guys appreciate our gems too. So I just want to make sure that we are continuously dropping new information, new resources, and information that aligns with current trends in healthcare and aligns with current trends in public health and the job market overall. Okay, Tyra, I go
Also,
live.
let us know what you guys want to talk about too.
Exactly. Tyra, I go live every Tuesday at 7 p.m. Eastern Standard Time. If you can't make it exactly at 7, you can hop on in whenever you get the chance, like how you just hopped on in. Tuesdays, 7 p.m. Eastern Standard Time, office hours with Dr. Johnson. I interview a new guest every day. We talk about a new topic every single day. So make sure you stick in. Thank you so much. Dr. Lewis, have a great night. I know
You
you're
too.
gonna call me later on about your faculty meeting, right?
Yes, sir.
Okay, no problem. Have a good night, okay?
Alrighty.
Have a good night, everyone. Thank you so much.
Bye.